All right, we're going to tell you about a lot of things right now, especially a warning from doctors about the dangers of delaying your health care.
In fact, some are telling us that they've never seen patients neglect their personal health as much as they are these days.
Because of that, healthcare providers say they are treating more patients with chronic heart disease and have also noticed increases in substance abuse.
7 Action News reporter Brett Cast hears from 2 Metro Detroit hospitals about how the effects of the pandemic still linger today.
Well, doctors here with Corewell Health Beaumont Hospital say that over the last 2 or 3 years since the pandemic began, patients have simply put off coming to the doctor to get checkups or do annual screenings, which have led to more serious consequences. At Trinity Health Oakland Hospital in Pontiac, chair of the emergency department, Dr. Raul Mehta, is one of 2 physicians who penned a letter to the community urging more proactive care.
It's gotten better since the height of the pandemic, where people were truly afraid of coming to the emergency department.
Dr. Mehta says the pandemic may have caused some people to delay routine checkups. Now, more than 3 years after the pandemic began, the ER has seen more patients with chronic heart disease, leading to heart attacks and strokes, much of which could have been avoided.
What this has caused is, an easily correctable event now becomes not so easily correctable.
He urges people to resume regular visits to primary care physicians, who also report seeing less patients in recent years.
What I've seen is a lot of people haven't come in the last 2 to 3 years.
Dr. Asha Shahjahan is a physician with Corewell Health Beaumont in Grosse Pointe.
We're seeing a lot of problems. We're seeing cancers that are being found at a much later stage. We're seeing advanced sugar problems, high blood pressure.
Dr. Shahjahan urges people not to delay getting blood work and cancer screenings like mammograms and colonoscopies.
And my advice is go ahead and just get it scheduled. It's a routine screening, even if it's in 3 months from now or 4 months from now. It's better to at least have that done at that time than not doing it at all.
Yes, I have been going to the doctors. Probably more now because they're doing it in person.
Many Metro Detroiters we spoke to say their trips to the doctor have resumed or never changed to begin with.
I usually go once a year. I try to stay on top of it.
Well, I haven't really missed anything, but I also have good health care through work, so that obviously plays into it for people.
Rising costs also played a role in the delay of health care. According to a recent Gallup poll, 38% of people report delaying health care in 2022 due to the cost, the largest amount on record. Doctors hope as the effects of the pandemic wane, more regular visits will resume.
I'm hoping that maybe in the next year or 2, we'll get back to, quote unquote, normal when it comes to people seeing their physicians and getting their screening tests. But we'll have to wait and see.
Again, those healthcare providers say if you have not been to the doctor in the last few years, you should get an appointment scheduled soon. And even if there are delays on some of those cancer screenings, it's best to get that scheduled. In Royal Oak, I'm Brett Cast, 7 Action News.